We begin the day with countries around the world monitoring and quarantining passengers evacuated from a cruise ship hit by a deadly Hantavirus outbreak. The World Health Organization has confirmed that 7 people on board the cruise ship Hondius are now known to have contracted the Andes strain of the virus. There are a further 2 suspected cases, while 3 people have died from the illness. The outbreak is believed to be the first linked to a cruise ship and has prompted an international response, with passengers now returning to more than 20 countries. Health officials say the strain can, in rare cases, spread through very close human contact, unlike most forms of hantavirus, which are usually linked to exposure to infected rodent droppings. Here in Germany, 4 passengers have been moved into quarantine in their home states after a medical assessment in a clinic in the city of Frankfurt. There's no indication of illness among them, according to a statement issued by the clinic. The World Health Organization says the overall risk to the public remains low, but is recommending active monitoring and daily health checks for passengers who may have been exposed. Let's bring in Torsten Feldt. He's a consultant doctor in infectious disease at the University Clinic in Düsseldorf here in Germany. He was one of the first physicians in the country to treat COVID patients back in 2020. Pleasure having you on the show today. Now, tell us, why are countries using quarantine-style measures for a virus the WHO says is low risk?
Yeah, first of all, it's always, as an infectious disease specialist, smart to be cautious here. And there are special circumstances here, as we have this human-to-human transmission on the boat, and all the information is not yet complete. And on the other hand, the virus has a high lethality. And this together is really, considering the recommendations, the current recommendations, is all reflected in how we protect ourselves and also the environment and the population.
Yeah, this human-to-human transmission we saw on the cruise ship, that's fairly rare. I keep reading that it's spread through very close contact. For me, at least, that's not precise enough. Can you explain how the human-to-human transmission of hantavirus actually works?
This is really what we know and what we learned in the past, that it's not a virus like COVID, which is transmitted just by passing by and like transmitted to 20 persons in a room via aerosols. But this is the general rule. But we know there are exceptions, and some of those transmissions might have occurred also on brief and not so close encounters. And this is why we are careful at the moment, and also want to protect our staff. And this is most important.
We're seeing people in hazmat suits. Some of the patients who are infected on the ship, they are being treated in bio-containment units that are designed for Ebola. There's 42 recommended days of quarantine. You say we're being very cautious here. All of what we're seeing, is that because the virus is especially dangerous, or because doctors still don't fully understand this outbreak?
No, it's being cautious. It's being really considering the lethality, and it's also reflecting that the recommendations are really also defining those measures, and this is what we are following. Basically, the reason why the patients and contact persons are handled in high-level isolation units, which are prepared for the highest level for Ebola, for Lassa viruses, is also that the networks are established, the infrastructure, the rooms, the premises are prepared for that. But also the teams are trained in using various kinds of personal protective equipment. This is what we are also doing, what we trained and what is practiced.
But then in other countries, we're seeing different approaches, people just being sent home to quarantine there. What determines which response is appropriate here?
Well, this is often the decision of local health authorities, so they can really make different decisions. In general, if a patient is a contact patient and does not have any symptoms, and medical care and like treatment is close and really assured on a timely basis in case symptoms occur, there is nothing arguing against the home quarantine. But there is also different risk constellations, and you need to be ready prepared to treat patients and to offer supportive treatment, ICU treatment, in case symptoms occur and patients are deteriorating. So there's a lot of variables, but there's also a lot of like different strategies to approach the situation within those recommendations.
Exactly, within those recommendations, but every country involved, you're talking about local authorities, they're kind of doing it their own way. Do you understand public concern about this? The memory of COVID is still very fresh. We remember the pictures of back in the day. Everyone says this is not the same, but the fact that it does very much seem like we're not entirely sure how this is spreading from one person to another, and it does kind of give the sense that there is no full control of the situation, at least.
You really cannot compare it to the COVID situation. As you say, when we faced the first COVID patients, we did not know the virus, we did not know how it spreads, we did not know how to protect ourselves, so what the risk factors are. And here the situation is totally different. We know the virus, it's a rare virus, but still we know it. We know how it is transferred from human to human, how the infection mode is. We really have a good information on the protection measures because we know how it spreads, and so we are ahead of the curve, as we also know the source of it, because all those patients, those persons are traceable down to the cruise ship, and this is why we can do effective contact tracing and can also isolate and quarantine the contact persons and the infected ones.
If everything goes according to plan, that is, the WHO came out today saying that they cannot discard that there will be more infections. At what point would epidemiologists begin to worry that this outbreak is becoming something more serious?
The point to worry would definitely be if infections turn up and are detected in persons which cannot be traced down directly to the cruise ship or to their direct contacts. And this is the important point. For now, we are really, and that is the authorities are after those, are really monitoring and in contact with the passengers, with their contacts, and are evaluating how high is the risk, do they have symptoms, test those persons, and then it's the challenge to decide how the management is done. But this is also the reassuring part here, that authorities and treatment centers and the WHO and the ECDC are really like working together in managing this situation. And as I say, contact tracing is one essential point, but this is intensely going on, and from my information, that is, we don't have this worrisome situation which we had with COVID, that infections were really like spreading without knowing where they came from, and you had infection chains and so on. So this is really, we are on ahead of the wave here, and this is what is the big difference, and we know the virus.
That's Dr. Torsten Feldt of the University Clinic in Düsseldorf. Thank you so much for those insights.
Thank you.